Physical therapy students in general is mainly we want to help people and we're problem solvers. So those two things are generally within PT students, and I encourage you as you go through your careers, don't forget why you started to be a physical therapist. And so that leads into who I am and what I was experiencing problems with my own body. I have this weird twist at C1, C2. I had some autoimmune conditions, so I found fascia. And at the time, nobody was really talking about fascia. It was like this obscure book that I found. Today, my goal is just to give you guys an overarching idea of what it is, because it's a concept that's so vast that there's really no way to talk about everything today, and there's still much that I don't even know yet, right? Because the great thing about this topic is that we just started talking about fascia as a medical community within the last 10 years. So what does that mean? There's still a lot of research to be done, and there's still a lot of breakthroughs, and there's still going to take time until actually this information gets into our textbooks. So the topic we're going over today is covered in physical therapy school to some extent, but probably not to the extent of the impact it can have if you start to use this with your patients later. So, and then also a little bit about me. So I'm outpatient therapist. I work at Physical Therapy Now in Irving. I am trying to start a company called Body Spring. I'm going to be patented in about a month on some physical therapy tools that I'm very excited about. And I am a ballroom dancer, so I'm always thinking about movement. The practical application, but I want you to understand of one simple thing that you can do with your patients that I don't really see therapists do in the clinic, just a slightly different way to prescribe Therax that looks more at the biomechanical chain than the individual area itself. So I want you guys to take a second, just very, very quickly, get in groups of 2, 3, 4, and I want you to talk amongst each other on what your understanding of fascia is. What are some buzzwords that you've heard with it, or some methods, some tools? What is your understanding of fascia? Okay, go. Right, so implications along the whole body, referral of pain maybe coming from somewhere else. Absolutely. Excellent. So good, you guys have a good baseline understanding. Some other things in pop culture, like you see myofascial release, you hear people talk about dry needling, foam rolling, also based on the ancient science of Chinese meridians. So kind of the medical version, or this new updated version of what traditionally is known maybe as like a Chinese meridian, potentially, they were looking at. So what is it? You guys did a really good job of describing it. It's all of your connective tissue, the sum total. So that means there's actually a lot of different subcategories within it that we're not really going to get into. But it's like I tell people it's like glue. It glues your bones to your muscles, to your tendon. And not only does it connect everything to everything, is it goes through everything as well, which is really interesting because it's around every myofibril, and then around every bundle, and then around the actual muscle belly, which becomes the tendon, and then the skin of the bone, the periosteum. So even like your liver, different organs, it goes through it. So when you were in anatomy lab, probably some of the things that you noticed about it was some of it was really thick and hard, and some of it you could just peel apart and just melted like butter. So there's a lot of different types of it. And so that just goes to show you how important it is. So it is actually the biggest organ in your body. So just think about that for a second. Something that probably your patients have never heard of before. They've heard of your liver, they've heard of your heart. A lot of people think the skin is the biggest organ, but fascia per square inch is bigger than any organ, and there's new research studies showing that it actually has cells all of its own. So a lot like how bones break down and rebuild. What is it called? Wolff's Law. The way you model a bone is the way the osteoclasts and the osteoblasts will break down and build up a bone. There's fasciacytes. So the fascia is remodeling with all of the movement that you do, and there's certain movements that I believe remodels it faster. So biggest organ in your body. So where is it? It's everywhere, essentially. And another important factor is it's like the highway for your nervous system. So you have more nerve innervation in your fascia than your muscles. So say you had a muscle strain. The pain actually might be coming from the fascia versus the actual muscle belly. Now, does it matter to get into the minutia of that with patients? Probably not, but it's pretty interesting concept. When we say it's a muscle strain, it actually might be a fascial strain, or both, right? So, because it's more innervated than the muscle itself. So why is this important now? Because we learn nerve innervation and muscles and anatomy based on, what does the bicep do? But biomechanically, does that really explain what goes on when you actually do a movement? Not really. So I believe that it's really important, especially as physical therapists, to really start looking at this stuff, because movement is not in a vacuum, right? It's not about, it's a good way to start to learn about the quadriceps straightens the knee, but how do we then take our anatomy knowledge and our movement knowledge to the next level? So think about this as a map that you can base other principles around. So here's just some idea of how they map out some connections from the fascia. The answers it provides, I believe, can help unlock areas for your patients and give you success as a clinician. That's what we want. We want to be the go-to clinician, and whatever setting you're in, whether it's in SNF or outpatient, doesn't matter. You can use these principles everywhere. So here's the official definition that I found of fascia, which is really long. I'm just going to read it, but just because it really emphasizes everything that it is, and it's a soft tissue component of the connective tissue system that permeates the human body, which forms a continuous three-dimensional matrix of the entire body, which extends to all fibrous connective tissues, including aponeurosis, ligaments, tendons, retinaculums, joint capsules, tunics of organs, vessels, epineurium, meninges, periosteum, and all the intermuscular fibers of the myofascia up to the endomysium, with function of structural and nutritional support. So that's important too. Nutritional also, which we're not even going to hash that out, but transmission of force. This is really important in biomechanics right here, transmission of force and communication. So like we said, everything. So I'm not going to get into the granular things here, but if you want to know, well, why is fascia important? Here is everything that it does. So force transmission, so how does a movement, the energy, the kinetic energy, move from your hand to your shoulder, maybe across your chest, maybe to the other arm, maybe if you're a pitcher in baseball, maybe from this leg all the way to this hand. Like, how does that actually happen? And how do we train it? Energy conservation. When your fascia is in good shape, you have to actually spend less ATP to do a movement. Lubricating fluid. A lot of times our bodies are stiff because we don't have that fascial gliding on one another. Proprioception, interoception, which was a new word I learned a couple years ago, but essentially it's the way that you experience your body from the inside. So it's just this idea of like how somebody's body awareness might be from person to person. Protection, so just like skin, it has protective nerve endings, and then there's different types. So a lot going on. And so this guy, Tom Myers, has a really popular book, Anatomy Trains. And so this is how he maps out the fascia. It's not the only way fascia is mapped out, and not everybody's body works perfectly like this, but these are really good drawings where you can go and kind of see where some of these muscular and fascial connections might be. Here's an example, the spiral line. We use this in a lot of rotational movements, including gait. So, I mean, even in older people, like these are athletes, but even in older people, you'll see people with like Parkinson's that just walk and they're not actually using any arm swing, they're not using any rotation. But we also see this in high-level athletes. They have a really good understanding of really how to use all of these arm lines. In golf, like the entire golf swing is just building up of momentum and releasing the fascia when you have an amazing swing. So the new model of fascia is that your core, we always think about your abdomen, right? So when somebody says exercise your core, but what we're realizing is this can be considered the core. And if you see, that's not just the abdomen. That is the whole body. So what does core mean? Core just means innermost. So you have an innermost portion of your hand, right? I mean, we all looked at the layers in anatomy. We all have an innermost portion of our forearm. We all have an innermost portion of our hip, innermost portion of our legs. And so to really engage the core, we could be talking about the core of our foot. And really what this is a body-wide tensional network that, I mean, like, have you ever seen Ninja Warrior, where like these guys are skinny, but they're so strong and they're able to do amazing feats? And it's really due to, you don't need a lot of muscle if you have this inner tension network that has a very connected sense to it, because then one thing is a chain reaction off of another movement, hence biomechanics, right? The way one part of our body moves in relation to another body, part of your body, right? So fascia up close right here. People talk about it as like the chicken skin, the meat, when you pull it back. Here is like a dissection, like a cross section. You guys have probably seen it in CT scan images. So you can then really see like the fascia wraps around all of this, wraps around that, that becomes the septa, wraps around those bones, wraps around the entire thing, goes through. And not only are there connections here, if you see the spiral, you can clearly see the spiral, but see all these offshoots everywhere? So it might have a pattern, but it's connected to other patterns as well, right? Okay, so I just found this super fascinating. So this is a dissection of our inner core, right here. Actual human tissue. At the top is the tongue, and that dome shape is what? What do you guys think that dome shape is? Diaphragm, right? You probably can read it too. And then it comes down here all the way to the foot. And it's this silken tent. I don't know really silken is the right word, but I've heard it described as that tent inside your body that gives somebody a really strong core. So a different layer of your fascia is the outside layer. So it's like, imagine the guy from the Blue Man Group. That entire bodysuit, that would be called his fascia profundus. So we all have fascia not only running around, but also going through. And so to kind of demonstrate how fascia is important, I had put together this model. I was calling her Amy, but it took me a while to figure out how, because I don't sew, how to kind of put this together. So when we're training a patient, say we're training the ankle and the foot. So in clinic, what do we usually do? We do, okay, what is this motion probably if this was a foot? Yeah, dorsiflexion, plantar flexion. And do we go this way? Yep, eversion, yep. How they do like some ankle circles, right? Maybe we use some like resistance bands to do those, right? We can do stuff with the toes. But what if the problem, you thought you wanted to work the fascial system? What would you do to then instruct them simply to try and activate their fascial system more? Because when we just move one joint like this, it is strengthening, which is good, but how do we go beyond strength to get this tension that's more going through the whole leg, maybe to the pelvis, getting this recoil effect. Recoil, that's really important for fascia. So imagine this was like the Blue Man suit here. So that's just one layer, but if it gets stuck on another layer, you could be strengthening it all you want, but it's still going to be restricted until you pull it, the fascial line, right? Does that make sense, kind of? So just like muscles, fascia has layers. So Amy, if you take off her, you say you were doing a dissection, you know, she has another fascial layer here. And so one of the fascial layers that I really like to study for SI pain, a lot of people have SI joint pain. It runs up their back. And so finding ways to exercise the foot to then go in, sometimes even release something that's higher up. Like you mentioned earlier back there. So I want everybody to stand up with me, and we're just going to do this quick practical activity. Okay. So if everyone has a sweater or a shirt or something that they can, like a piece of material, I don't know if guys can like take off their shirt or what, but you're going to need something to kind of like hold on to that's fabric. Okay, so I'm going to take you through a series of exercises. Okay, everybody ready? So make sure there's a little bit of space in front of you. I don't want you taking out your neighbor because we're going to do like a punch in the air, okay? So all I want you guys to do, so I use this activity for a lot of patients when they have, sometimes they have anterior shoulder pain. Sometimes it's impingement, arthritis, a combination, rotator cuff fraying, labrum problems. This anterior shoulder pain due to bad posture, being on the computer, being on our phones, is a very real thing, and it's very prevalent in the clinic. So what we're going to do is, you can set the material down for now. All I want you guys to do is just punch out into the air. Do it about 10 times, like it was an exercise. You're just... Good. Okay, now all I want you guys to do is a serratus punch. So come out here and come out of your shoulder girdle. Just do a serratus punch. Do about 10 of those. Okay, now I want you to combine the serratus punch with the punch. Okay, so I want you to punch out, and at the end, give it a little serratus punch. Okay. Good. Now what I want you to do is relax your arms. And now I just want you to straighten your arm so you get a tricep contraction in it. Straighten it so much that you feel your triceps activating. If you can. Good. Do that about 10 times. Okay. Now, grab your material, and I call this the sewing technique, but essentially I want to engage your pad dab muscles by giving something in between your fingers to squeeze. So you're going to take one finger, loop it in here, take another piece of the material, loop it in between your other two fingers, take the material, loop it in those four, like that. Try to get quite a bit of material in there. Yeah, you can do it like that. That looks good. Yeah. And then close your fist around the rest of the material. Okay, so now I want you to notice the difference between the punch we did at the beginning and the type of punch we're about to do now, okay? So all I want you to do is I want you to practice this motion of squeezing your hand together into a fist with all of that material in your hand. And if you just squeeze your hand like that, you should already start to feel more muscle activation up your arm, maybe even into your shoulder, but definitely your forearm. So I'm going through this kind of fast, but what I want y'all to do is I want you to go back into the punch exercise. You're going to engage your serratus, straighten your arm all the way, and keep this squeezed. So and you should feel kind of the hand, the forearm, the shoulder, the serratus, all acting as one biomechanical unit, okay? Okay, good job. You guys can sit down. So I went through that pretty quickly, but if you train that in patients, if you train them not only to do shoulder exercises by hitting like internal rotation, external rotation, flexion, extension all the time, if you train them to learn one exercise with the hand that activates the forearm, another exercise with the elbow, an exercise with the shoulder, and an exercise with the serratus. Maybe if you have a patient that's very self-aware, maybe one session. It might take a patient a little bit longer. But once they understand how these seemingly separate activations can then be put together in one biomechanical movement, that will free up fascia within your patient, doing things not much differently than you would do when you would prescribe exercise, but with a different mindset involved, a different philosophy of one thing connecting to another, connecting to another, connecting to another, okay? So it's all about, that exercise was all about the mindset in how you would instruct a patient on how to get biomechanical change. And so when I see patients with anterior shoulder pain, I don't always get them to punch, but sometimes I get them just to reach out in a serratus punch and do this activity as they go into flexion. And I have to tell you that it gives them immediate relief of their symptoms, most of them. So whenever you can give immediate relief to a patient, I think it's magical. I love it. And I think that most clinicians live for that feeling as well. So coming up with these and really understanding what you can easily do for your patients very quickly by just slightly changing your mindset can be really powerful as far as patient outcome and job satisfaction. So what did anybody notice with that activity? Any thoughts?
Burning sooner.
I started burning sooner. Good.
That's what I was supposed to feel. I'm not really sure.
No, I don't think there's a right or wrong answer. Sometimes if patients tell me that it was super painful, I try to figure out why they're having pain, or if it's truly bad pain, or if a lot of times the burning sensation is good pain. So there's not a right or wrong. You're right. You will feel, a lot of times if you give somebody what looks like a simple activity, but you teach them in this way, the response almost always is, oh my gosh, that's harder than I thought. So I have really strong guys come into the clinic, and I used to be intimidated to work with them because they'll have like this physique of a god, and I'll be like, oh my God, like you must be in the gym every day, all of your muscles are pretty strong, but when you get down to it, a lot of the stabilizing muscles are actually weak. A lot of these deep tensioning muscles are weak. And so you can take someone that looks very strong from the outside, and this is just a discovery that I've came across after being a clinician for so long, and you put them into exercises like that, and they are at first kind of like, oh yeah, okay, sure. And then you see this change, like, oh wow, okay, like I really am weak in this area. And you get buy-in from a patient, because a lot of times you want to work with a patient, an outpatient anyways. This is what will happen. They come in, you'll do an evaluation, you want to work with them. Maybe they're highly motivated, which are good patients to have. Maybe you want to work with athletes, but maybe you just want them to come back to the next visit because maybe they have a copay that's $50 and you need to show value in that first visit. So when somebody has a self-discovery, like seeing an exercise and thinking it's easy, but then trying it and discovering something new about their body, that is really powerful in the clinic, and that will keep people also coming in, coming back to you, and that way you can really have better outcomes the longer you work with somebody, right? So anything else? So what are other ways fascia is used? Yoga. So a lot of times people will do stretches, like somebody mentioned the posterior chain earlier. And so this is essentially